Meantime, the number of coronavirus cases in the United States has now topped 46,000, with nearly 600 deaths. In his latest op-ed piece, former FDA Commissioner Dr. Scott Gottlieb looks at how much longer the lockdowns that we're seeing across the country could go on and what we can expect in the coming weeks. Dr. Gottlieb joins us now. He's, of course, a CNBC contributor and serves on the boards of Illumina and Pfizer, and we've been privileged to be able to talk to you virtually almost every day these past several weeks. Doctor, the president said last night that he's looking to reevaluate things, try to get the economy moving more quickly, and wants to reevaluate it potentially beginning as early as Monday. Is that advisable?
Well, I think it's good to reevaluate where we are. If you look at what's happened in other countries, though, the time between the implementation of the more restrictive measures like lockdowns, significant social distancing to when they hit their peak in the epidemic was anywhere from 4 to 6 weeks. I think that we're going to be on probably the better end of that, hopefully, because we caught this earlier in this country than China did. China was about 6 weeks. If you look at Italy, they're probably peaking out now, hopefully, and it's been about 4 weeks, been about 30 days since they've implemented their measures. So I think this is going to be a long fight. I think we need to keep this going several more weeks. But there is an end to this, and we know where it is. We now have experience with South Korea, China, Italy, to know where the epidemic curve peaks out when you implement these kinds of measures.
So just give us the timeline that you see as of today in the United States.
Well, we're now 1 week into this in most of the places where you have sustained community transmission that we know about. So it's going to be another 3-4 weeks until we see the peak in the epidemic curve in regions like New York. That's the hopeful case. Once you hit a peak in the number of cases and you start to come down that epidemic curve, you can start to substitute in case-based interventions that target individuals who are infected with the virus for population-based mitigation, population-wide measures like what we have now, lockdowns, closed businesses. And so you can slowly take your foot off the brake of population-based mitigation and press down on those case-based interventions. And hopefully we have more screening in place, and that's going to help us do that. But we have another 3, maybe 4 weeks to go until we get there in New York, in the New York tri-state area. And then there's a question of whether or not other regions of the country are going to be hot later. There's probably a couple of cities, more than that, that are two behind New York. Louisiana, Chicago look concerning. Washington, D.C. metro area looks concerning. Probably San Francisco, Seattle are on a similar timeline to New York in terms of when it started and where they are right now.
Doctor, real quick, can you speak to this issue, which is, and Tom Friedman's going to be on later, and he's been writing about this, others have been talking about it, the idea of potentially allowing people under a certain age who are less likely to have a genuine health impact to go out and to start working, to almost tier, if you will, how we do this, effectively self-quarantining people over a certain age. Does that work in your mind? And some of the numbers I have seen suggest that there's 65 million homes that are what are called multi-generational homes. And so I'm trying to think how we could make this happen given that.
Well, it doesn't work so long as you have sustained community transmission. We have to break the chain of transmission in the areas where this virus is spreading rapidly. And it also turns on what you consider a significant health impact. If you look at the hospitalization rate in New York City right now, 56% of those who are hospitalized are under the age of 50. If you look at the ICU wards in New York City, it's not just 85-year-olds on those ICU wards and intubated. It's 30-year-olds, 40-year-olds, and 50-year-olds. Yes, the 30-year-olds, the 40-year-olds, and the 50-year-olds are surviving this illness after long, sustained ICU admissions, prolonged ICU admissions, but they're going to have a health impact from that. This virus is sparing no one except those perhaps under the age of 20, thankfully. It is the case that people over the age of 65 can't survive the critical care like a 40-year-old can or a 50-year-old can, but those 40-year-olds and 50-year-olds are spending weeks in the ICU in order to recover from this illness, and they're being affected at a significant rate. So to think that this is just a disease that's impacting people over the age of 65, that's just not what the data shows.
Do you think the president understands what you just said?
Look, the White House has the same data. I've been talking about this for a while now. If you look at the hospitalization data from China, and they were hospitalizing sick patients, this looks very Spanish flu-like in terms of the fact that people who are being hospitalized at a high rate are 40-year-olds, are 50-year-olds. The data from the MMWR, from the CDC, our own CDC, shows that 10% of people between the ages of 55 and 65 were in the ICU. About 5% of people between the ages of 22 and 44 were in the ICU here in the United States, and that's early data. When you're in the ICU for a sustained period of time, there's a good chance that you might have long-term health sequelae from that. So this is not trivial, the fact that, yes, 40-year-olds and 50-year-olds are surviving at a much higher rate COVID-19, but many of them, or at least some of them, a good portion of them, are surviving after prolonged admissions to the ICU and a lot of critical care.
Hey, Scott, let me ask you, you said 3 to 4 weeks to go, I think I heard, in the New York area. Is that better than you had anticipated before? And when you start hearing Virginia saying they're going to close school for the rest of the year, colleges say they're not coming back, things get pushed off, the president even canceling the Camp David meeting that he was scheduling for June before with the G7, did they move too quickly to stop all of those things, or were those the right moves?
Well, I think some parts of this country moved quickly relative to the spread that they were having, and some parts were slower to implement the more restrictive mitigation steps. Certainly, Washington State was slow to take the kinds of measures that they should have taken weeks ago. In terms of the curve and what it looks like, I think it still looks like what people were modeling is at some point in mid-April to late April, we're going to peak in the regions that were affected the earliest in the United States. And New York's certainly one of those regions. New York seems to have been heavily seeded, which should have been understandable why they have so much travel coming into that city. But in those regions, we're probably, 3 to 5 weeks away from seeing a peak, and hopefully on the lower end of that, maybe about 5 weeks if you want, 4 weeks if you want to, get a round number. But at some point in mid to late April, they will peak. I mean, we now have experience with multiple countries watching what happens with the epidemic curve after you implement these mitigation steps. We just need to stick with it, because once we break off sustained community transmission in those regions, we can start to slowly lift these population-based mitigation steps and substitute in technology and case-based interventions to keep this virus from springing back up. That has to be the goal.